Acute Care Nurse Assistant, Module 16, Pediatric Care. Content 1, Basic Terminology, including terminology and clinical setting application. Content 2, The Principles of Growth and Development. A. Definition. Growth is a process of physical changes that occur in a steady and orderly manner. It can be measured in height and weight, changes in appearance, and body functions. Development relates to changes in mental, emotional, and social functions. B. Principles. Growth and development overlap. They depend on each other and occur at the same time. For example, an infant cannot coo, development, until the physical structures needed for speech are strong enough, growth. The process starts at fertilization and continues until death. The process proceeds from the simple to the complex. A baby sits before standing and stands before walking. The process occurs in certain directions. A. From head to toe. Babies hold up their head before they sit. B. From the center of the body outwards. Babies control shoulder movements before they control hand movements. The process occurs in a sequence, order, and pattern. Certain skills must be completed during each developmental stage. A stage cannot be skipped, and each stage is the basis for the next stage. The rate of the process is uneven and is not a set pace. Children have growth spurts. Some children develop faster than others. Each stage has its own characteristics and developmental tasks. Content 3. 3 major theories on growth and development and how they relate to the hospitalized infant. Erickson's theory of psychological stages. The major task at this stage is to acquire a sense of trust. Needs include physical, nurturing, and an opportunity to explore the environment. Fears include separation anxiety, when the parents leave the room, for example, and strangers. Piaget's theory of cognitive development, from 0 to 2 years. Related to sensory motor development, learning occurs by the baby's use of their senses. Object permanence is a major task of this stage. This occurs when the infant understands that objects and events continue to exist even when they cannot be seen, heard, or touched. Vygotsky's theory of cognitive development. Social interaction plays a fundamental role in the development of cognition, or learning, from the first day of a baby's life. Social and cognitive development of new material is interrelated and builds on each other, scaffolding. Social surroundings, such as the family, community, and culture, and interactions with peers or adults, assist a child on the verge of learning new information or skills. Effects of hospitalization and multiple caregivers may include delayed bonding, limited ability to explore their environment, and a disruption of routines. Interventions to encourage trust, providing constant caregivers and routines, encouraging parental presence and participation, providing sensory stimulation of all the senses, and encouraging age-appropriate skills. Content 4. The nursing assistant's role for the hospitalized infant. General approaches include: pay attention to nonverbal clues. Allow the parents to stay with the infant and/or hold on the lap during observations and care. Talk to the infant during care. Show concern for the family. Allow family members to help take part in the child's care when possible. Safety general guidelines. Without the side rail up, use safety straps in high chairs and wagons. Use bath thermometer when testing bath water. Always test temperature of formula on the inside of your arm before feeding. Check label on formula with diet order. Fluid and heat loss. Provide measures to maintain body heat. Do not use heating pads. Observe the infant's stool at each diaper change. Normal stool color is a yellowish or mustard color for the bottle-fed infant, with a greenish tint for the breastfed infant. Consistency will be lumpy but soft for bottle-fed, and looser and smoother with the look of tiny seeds for breastfed. 1 to 3 bowel movements a day is normal. Report any abnormal color, consistency, or frequency. Observe urine for color and frequency. Weigh the diaper as directed. During emesis or vomiting, prevent aspiration by turning baby to side or face down while holding. Differentiate between spit up and emesis. Measure any emesis if possible. Note color and consistency. Always report any emesis. Keep an accurate input and output. Airway risk. Keep small objects out of reach, anything less than 1 3/4 inch in diameter. Avoid propping bottles. Do not feed small foods such as raisins, grapes, or nuts. Do not place the infant on their stomach while in a crib. Signs of stress to be reported to an RN. Skin color change. Rigid extension or limpness of extremities. A gaping open mouth. Fingers splaying. Fisting. Gaze aversion. Arching the back. Lethargy or drowsiness. Any change in vital signs. Feeding. Bottle fed. Check order and temperature of formula. The formula and bottle are sterile. Avoid touching the nipple or inside of the cap. Tilt the bottle so the nipple is always full of milk and the air in the bottle rises. Always hold the infant in a slightly elevated position, with the arm supported while feeding. This is a great time for bonding. Burp the baby after every 1 to 2 ounces. Breastfed. Have the mother wash her hands. Make the mother comfortable by supporting her back and the arm that is holding the baby with armchair supports or pillows. Make sure the mother has a call light nearby. Never leave a sleepy mother alone while she is holding the baby. Notify the nurse if the mom is having difficulty nursing, has sore nipples, or has breastfeeding questions. Burping methods with a clean towel or diaper. Over the shoulder, on your lap. Diapering. Use disposable gloves. Wipe from front to back using a baby wipe or warm soapy water. Rinse and dry well. Observe appearance of skin for redness or rash. Apply any creams or lotions only if ordered. No powder. Follow the special handling guidelines for the disposal of diapers and infants receiving radiation therapy or chemotherapy. Cord care. Keep the diaper folded down away from the cord. Clean around the cord with alcohol or as per policy. Never pull on the cord. Report any signs of infection or bleeding. Circumcision care. Wash gently around the penis with warm water and a cotton ball. Observe for any bleeding. Apply petroleum jelly gauze dressing, or according to policy. Note first voiding. Handling the infant. Cradle hold, football hold, shoulder hold. Communication. The infant communicates with her cry and body movements. Infants respond to voices, faces, and touch. Talk to the infant whenever giving care. Routine procedures. Vital signs. Place the BP cuff on leg. Take apical pulse if not using an automatic machine. Place pulse oximetry tab on toes. Weighing the infant. Measuring length. Measuring head circumference. Urine and stool testing per hospital policy. Selection of age-appropriate toys for the infant, such as mobiles, soft toys, musical toys, large balls, unbreakable mirrors, push-pull toys, and different textures. Content 5. The 2 major theories of growth and development and how they relate to the hospitalized toddler. Erikson's psychosocial stage. Autonomy versus shame and doubt. This is the stage the toddler strives to control body functions, learns to do things unassisted, and differentiates self from others, autonomy. It is important that the toddler is given time to accomplish a task, is praised for their efforts, and has set routines to foster a sense of control. If the toddler is unable to accomplish this, by being prohibited or ridiculed, the toddler may develop a sense of shame and doubt. Piaget's cognitive stage. Sensory motor, 0 to 2. Unable to distinguish between own perspective and that of someone else. Age-specific characteristics. Likes to run and explore the environment. Potty training. Imitates behaviors. Plays pretend games. Effects of hospitalization may include fear of separation from parents, loss of control, pain, going to sleep, regressive behavior. behaviors that represent attempts to gain back control. Negativism, saying no. Protests, cries, kicks, biting, tantrums, physical escape. Ritualism, relying on routines, insisting on doing things in a certain way. Defiance, refusing to follow requests. Dawdling, responding slowly and offering excuses, a short attention span. Possessive of their toys. Content 6. The nursing assistant's role in caring for the hospitalized toddler. General approaches. Minimize separation from parents and involve in care as much as possible. Keep security objects close, such as a favorite blanket or toy, and allow to hold. Provide continuity in familiar routines of eating, toileting, and sleeping. Recognize that any intrusive procedure may provoke an intense reaction out of fear, not pain. Use distraction by telling a story or singing a song. Do any preparations for a procedure out of the child's sight. Give the child something to do during the procedure. Use a doll or toy to approach a child. Allow the child to do as much as they can to maintain their independence. Allow some choices and enough time to complete tasks. Use age-appropriate language or terminology. Safety. Continue to keep small objects out of reach. Ingestion of foreign substances is very common at this age. Do not leave a child unattended without the side rails up. Selection of age-appropriate toys. Music. Things that turn, ring, and push. Large blocks. Toys to roll and catch. Introduce yourself. Use the name or nickname the child prefers when addressing them. Give explanations that are honest and simple. Talk to the child during playtime, not just when you are providing care. Use play as a technique. Let the child handle appropriate medical equipment, but nothing sharp, before procedures. Content 7. 2 theories on growth and development and how it relates to the hospitalized preschooler. Erikson's psychosocial stage. Initiative versus guilt. The preschooler strives to master their environment by successfully completing tasks such as dressing unassisted and helping around the house. The child develops guilt in the form of inward anger when unable to accomplish this. To define the boundaries of self, the child tends to be anti and demonstrative. Fears include bodily injury, loss of control, the unknown, the dark, and being left alone. Piaget's cognitive stage, pre-operational, 2 to 6 years. This age group is unable to distinguish between their own perspective and that of someone else. Their ability to think is only of one concept at a time. They have magical thinking belief that thoughts are powerful and can cause events to occur. They believe inanimate objects can have lifelike capabilities, and that events that occur at the same time have a cause and effect relationship. Effects of hospitalization. The parents may become overprotective. The child can demonstrate regressive behavior, eating and sleeping problems. The child may attribute illness to her own bad behavior. Typical behavior when scared. Protest, despair, and detachment related to separation. Aggression, physical and vocal. Dependency and immature behavior. Feelings of anxiety, guilt, or shame. Content 8. The nursing assistant's role in caring for the hospitalized preschooler. Teaching. Use play as a technique to teach the preschooler about their care. Prepare the child for 1 to 2 days in advance of major procedures or events. General approaches. Encourage expressions of fear and anger. Offer simple choices and explain how the child can help with their care. Involve the family in all teaching and encourage participation. Maintain a consistent routine. Emphasize that illness is not the child's fault. Always tell the child what you are going to do. Reinforce positive coping behaviors. Stickers may be helpful in this case. Selection of age-appropriate toys and activities. Climbing equipment. Crafts. Puzzles. Dress-up. Drawing and coloring. Content 9. The 2 major theories of growth and development and how they relate to the hospitalized school-age child. Erikson's psychosocial stage. Industry versus inferiority. In this stage, the child strives to do and make things with others. They learn to accept instruction and to win recognition. The child becomes increasingly peer-oriented. The danger in this period is the development of a sense of inadequacy and inferiority if the child does not receive recognition for their efforts. Major fears are loss of control and independence, death, bodily injury, not being able to live up to the expectations of others, interruption of daily routine, separation from peers, and unknown events and procedures. Piaget's cognitive stage, 2 to 6, see preschool. Piaget's concrete operational, 7 to 11 years. The operations or skills to be developed are logical thinking, which includes the recognition that some properties of an object can stay the same despite changes in other properties, the ability to group objects according to shared characteristics, and the ability to manipulate numbers. Age-specific characteristics. Visible signs of reproductive maturity may become evident around 9 to 12 years. They need privacy. They are self-conscious. Needs parental support in times of crisis. Understands cause and effect. They are easily influenced by peers. They are reluctant to ask questions. Has personified concept of death. Has a tendency to nod with understanding when in reality they don't understand. Effects of hospitalization. May have insomnia, nightmares, bedwetting, and fear of the unknown. May miss school and other important activities. Interruption of daily routine and separation from peers. May become uncooperative and whiny. The nursing assistant's role in caring for the hospitalized child ages 5 to 12. General approaches. Give choices for an increased sense of control. Give the child a choice of having the parents present during procedures. Provide privacy. Make sure that the child has underwear on and cover their body well with sheets. Select age-appropriate activities, arts and crafts, puzzles, board games, and books. Communication. Provide concrete and complete explanations. Ask the child to explain what they understand. Use games to teach. Prepare days in advance for major events such as surgery. Use body diagrams, pictures, and models. Emphasize the normal things that the child will be able to do. Content 11. 2 theories on growth and development and how it relates to the hospitalized adolescent. Erikson's psychosocial task to be mastered is identity, to develop a sense of individuality as a sexual human being. This is marked by the gradual development of sexual maturity, a greater appreciation of the individual's own identity as a male or a female, becoming independent from parents and adults, establishment of personal coping systems, and developing morals, attitudes, and values needed to function in society. Piaget's cognitive stage, formal operational thought. This is the time the adolescent starts to build theories, speculate, and hypothesize. Although this is the beginning of scientific reasoning, the adolescent has difficulty thinking rationally about immediate experiences. Age-specific characteristics. Socialization is important. Rapidly changing body image relates to self-esteem. Need for privacy. Increasing independence and responsibility. Struggle to develop self-identity. Use of deductive reasoning and abstract thought. Effects of hospitalization. Loss of independence and control. Threat of change in body image. Restriction of physical activities. Fear of rejection from peers. Fear of death. Can be uncooperative and refuse treatment. Verbal or physical aggression. The nursing assistant's role in caring for the hospitalized adolescent. General approaches. Respect and maintain privacy. Involve adolescent in care and decisions. Encourage visits from peers. Set limits when appropriate. Be as flexible as possible. And be honest. Communication. Be sensitive to body language. Avoid talking down to, but clarify and reinforce information. Avoid power struggles. Be a good listener. Content 13. What the common stress periods are in the hospital experience. Admission, blood draws. Surgery, the day before surgery. Preoperative medications. During transport to the OR. And waking up in the recovery room and the following 4 to 8 hours. Module 16, Measurements of Height and Weight. Measurement of height. Infant. Lie the infant straight on a surface. Mark a small pencil mark at the top of the infant's head and a mark even with the heels on the sheet under the infant. May have to gently straighten a leg to obtain. Measure from the mark at the head to the mark at the feet using a tape measure. Document height on chart in centimeters. Child. Stand facing away from the balance bar with a shoulder, buttocks, and heels together. Raise the height bar until level with the top of the child's head. Child's line of vision should be parallel to the floor. Note measurement in centimeters and document. Weighing the infant or child. Wash hands. Identify the patient. Place a small sheet on the scale and balance with the sheet on it. Check the infant's previous weight. Remove the infant's diaper and clothes. Place the infant on the scale, keeping a hand over the infant to prevent falling. Move the bar until the scale balances. Document in kilograms or per policy. Note: if weighing a toddler who is unable to stand on their own, pick them up and step on the scale. Obtain the combined weight. Weigh yourself and subtract your weight from the combined weight. The toddler's weight is the difference. Vital signs for infants and children. Normal vital signs for infants and children are different from those of adults. Refer to the chart below. Thank you for your attention.